Hey everybody, it's Justin, physical therapist from IPT. Today I want to talk to you a little bit about pain. I wrote the newsletter and the blog for this month, and it's all about pain science, how pain affects us, and kind of some misconceptions and truths about pain and the current evidence behind it. Today I'm going to talk to us a little bit about how we can adjust our state of mind to affect pain levels and stress levels. So a lot of times when we're in pain, what happens is we get into what's called a sympathetic response. So this is controlled by our autonomic nervous system. So we don't have a ton of conscious control over it. But basically what this sympathetic response is our fight or flight state. So we get a bunch of different hormones released, our heart rate is elevated, our blood pressure is elevated, and basically it's great for survival if we need to face something or get the heck out of there. But what it's not great for is to be in for a constant state of time, and in our society of stress and constant stimulation, that's where a lot of us spend our time. We're actually more prone to pain levels in that sympathetic response. So the opposite of that sympathetic response is the parasympathetic. And the parasympathetic is our state of rest and digest. So this is our state of optimal healing, recovery, and just great overall for a calming mind and not to be in that stressful state. So today what I wanted to do is teach you a little breathing technique to get us out of that sympathetic state and into the parasympathetic state. So this breathing technique, you can do it in sitting, standing, laying down, you can do it anywhere, but I'm going to challenge you to take a couple minutes out of your day and actually try this and see how you feel afterwards. So I'm going to run you through it real quick. You're going to take one hand on your belly, one hand on your chest, and all we're going to do is take a nice deep inhale for 4 seconds through your nose, trying to expand through your belly rather than through your chest. Okay? So it's going to look something like this. And then we're going to hold for a second, and we're going to do a nice 5 to 6 second exhale through the mouth. And you want to try and make that exhale a little bit audible by closing the space in your throat back there. What that's going to do is kind of force the air out nice and slow and allow your mind to kind of relax a little bit. And then from the side, just so you can see how much of belly expansion we're getting, it's going to look like this. So I want you to try this for about 5 to 8 minutes of just this style of breathing. Now, if we're not used to this, it's common to get a little bit lightheaded because we're just oxygenating our blood and our cells really well with this style of breathing. But try it out and see how you feel afterwards. You might notice you're in a little bit more relaxed state, in a better mood, a little less pain. That's the goal. So practice this for a couple weeks. At the beginning, it's going to be a little bit tough. But as you go, it should get a lot easier, just like anything you practice. I hope you guys have a good day. Bye-bye.